So firstly, why do we offer smears? So a smear test or cervical screening can prevent cancer. I think one of the most important things you might take away from today is that a smear test is not a test for cancer. We're actually trying to prevent the cancer before it develops. This is really important because cervical cancer is the 4th most common cancer in people with a cervix. So with the people that currently attend the smear program, about 5,000 cases of cancer are prevented each year, okay? And 99% of cervical cancer is preventable, so we can stop it even before it happens. If everyone attended their smears regularly, we would stop about 83% of all cervical cancers. And it's important to know that without coming for your regular smear tests, we can't actually prevent cervical cancer. So just quickly to go over anatomy, so you understand what we're talking about when we say cervical screening. At the base here, we have the vagina. This is someone's torso, and at the bottom would be the entrance or the labia. At the back of the vagina, you can see this slight narrowed area leading to the uterus or the womb. This narrowed area is the cervix, or sometimes it's called the neck of the uterus. And this is the area that can be at risk of cancer. And this is where we will collect the sample in order to carry out the test. So the reason we can prevent cervical cancer is that nearly all types of cervical cancer are caused by something called HPV, or human papillomavirus. HPV is very common, and most people will have HPV at some point in their lives. There's over 200 types of this virus. If you ever had a wart on your hand, or one of your children has had a wart, that's probably caused by the HPV virus. And about 40 types of HPV affect the genital area. It's mostly spread through sexual contact, so that can be through vaginal, oral, or anal sex, but also through touching the genital area or skin-to-skin contact or sharing sex toys. So it's important to know that HPV can be spread even without sexual intercourse. For this reason, condoms can reduce the risk of HPV, but not completely reduce the risk. And you can have HPV from having sex just once or sexual contact just once. And this could have also happened a very long time ago. It's important to know that while HPV is very common and most people have it, only about 0.2% of people who have HPV would ever go on to develop any kind of cancer. And we don't actually treat HPV more often than not. There's usually no symptoms and your body will get rid of the virus naturally. About 9 out of 10 people will get rid of that virus within about 2 years of contracting it, and you wouldn't usually know that you've had HPV. As I mentioned, sometimes it can stay in the body for longer, and sometimes that can be for many years. If your body doesn't clear out the HPV and it stays in there for a long time, it can cause the cells in your cervix to change. We're not exactly sure why some people have HPV for longer. It could be to do with the immune system or the type of HPV. What we do know is that smoking increases your risk of long HPV infection because it affects your immune system. So if these cells start to change, your body can usually get rid of them, but without any kind of treatment, it is possible that over time it would develop into cancer. The good news is that we can check whether or not you have HPV, and this is using your smear tests. It will see if you have HPV in your cervix. If you do have HPV, you don't need to be worried. We don't treat it. But we will also check the cells, which are collected at the same time as your smear, and see if there are any of these changes we spoke about. And if there are cell changes, that means that we can treat the changes before it has the chance to turn into cancer. So if you're ever told you have a positive smear test, it doesn't mean that you have cancer, only that we might need to do more tests or more treatment. So who should have a smear test? The answer is anyone with a cervix. So this is women, trans men, and non-binary people assigned female at birth. If you've had a full hysterectomy and no longer have a cervix, you don't need to attend for a smear test. If you're not sure if you've had a full hysterectomy, you can always check with your GP. Trans women also do not need to have a smear test. If you've had a smear test previously outside the UK, you can still have one in the UK, and we recommend that you do. This is because some countries do the tests a little bit differently. The first smear test is done at around the age of 25, and people will usually receive an invitation. We don't offer smear tests under this age because in this age group, the risk of cervical cancer is very, very low. There's also often changes to the cells in the cervix around this time that usually resolve themselves, so it would cause unnecessary worry coming in for screening. If you're aged between 25 and 49, you're recommended to attend for smear tests every 3 years, and you'll usually be invited in for those. Due to current IT limitations, people registered with their GP practice as male or non-binary won't receive an automatic invite for their first smear test, so you'll need to contact us to opt in. Between the age of 50 and 64, your smear test will instead be every 5 years. And we don't normally carry out smear tests from 65 and over, as long as your most recent tests have all been negative. This is because it's very, very unlikely that you'll ever develop cervical cancer over the age of 65 if you don't have HPV. If your last smears were positive, you might need to have additional tests after the age of 65. And if you've never had a smear test and you're over the age of 65, you're welcome to request one. Some people do need tests more frequently. For example, if you're living with HIV, we recommend annual screening. It's important to note that we can't offer additional smear tests, so we only do them every 3 or 5 years, which is enough for the purpose of preventing cancer. A couple of other things to mention: it's best to book your smear test when you're not having your period. This is just because the blood can sometimes affect the sample. And you don't need to have a smear test when you're pregnant. We recommend booking it in about 12 weeks after delivery. So what happens at your smear test appointment? We're going to be asking you questions, usually about your most recent period, if you're using contraception, and if you currently have any symptoms or concerns. We might also ask you about previous pregnancies, sexual partners, and whether you've experienced abuse or cutting, also known as female genital mutilation. You'll be offered a chaperone. So this is a trained member of staff who can stay in the room with you during the test if that would make you feel more comfortable. But you could also bring a friend or a family member if you like. The nurse will explain the test and how you'll receive the results, and you can then ask any questions that you might have or discuss any concerns. So now we're just going to go through what you can expect at your appointment and some of the equipment. So I'm just going to stop sharing my screen. And Rebecca, are you ready to talk us through?
Yeah. So hiya. So after we've discussed the questions for the consultation, I will lead you over to the bed. I'll ask you if you can remove the lower half of the your clothes. I will draw the curtain. There will be a bit of couch roll, so you can put over yourself so you don't feel too exposed. I will ask you if it's okay to lock the door. And then I will, when you're ready, I will come round with the equipment. I've got a speculum here. They do come in different sizes, so feel free to ask for a small if you want to. The sizes aren't usually to do with the width, it's to do with the length. Some women are tall, so it means their cervix can be sit a bit higher, but feel free to ask for a small. We generally start with a medium, but yeah, don't be scared to ask. Once you've gone round the curtain, I will ask you to get your legs in position, just your knees to the side, feet together, and I will put some lubrication on the speculum to make it feel more comfortable. Relax as much as you can. Easier said than done, but just breathe. Vaginal muscles are very strong, So as more as you can relax, the easier the speculum will insert. Once I've inserted the speculum, I'll let you know I've opened the speculum to look for the cervix. Once I've found the cervix, I will use a cervical brush. It's very soft. It will go inside slightly around the and inside the cervix, and it will swivel. It will open up like a fan and swivel round the cervix, collecting cells. Once we've done that, I will put the brush where I've collected the cells into a vial, trying to get all the cells I can off from the brush. And I will leave you, close the curtain, let you get dressed, and it could be really, really quick.
Thank you. And do you mind just showing us that speculum if you take it out of the packet? It's a bit hard to see on the screen.
Oh, was it? Okay, sorry. So this is a small one. I don't know if you can, it looks a bit scary on the screen, but it's not, yeah, it's quite small.
And so that's inserted with the lubricant. And then how does the brush, how is that used?
Yeah, so once we've inserted with the speculum, then we open up slightly, and then the brush will go through, and then we'll swivel round the about 5 times around the cervix, collecting the cells.
And how long does that bit take?
Probably about maybe less than a minute. Once we find the cervix, it's very, very easy.
That's brilliant. Thank you very much.